Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, I'm going to be going over questions that are samples for the next generation NCLEX for PN. This is going to be a multi-part series, so this is part one. And guys, this comes directly from NCSBN. So if you go onto their website, you can go ahead and download their test plan as well. I plan on actually dissecting that whole booklet and going over it with you, but you guys can get it yourself. Just go directly to their website, nclex.com. You can download the one for PN if you want PN, or the one for RN if you want RN. It's right there. So for this video, guys, I'm going to be going over different questions so you can get a feel of what they're looking for. I'll go over the correct answers, same thing. Why the incorrect answer is an incorrect answer, just so you can get a feel of what the test writers are looking for. Now, this is a very, very informative booklet, so I do encourage you to go on their website to download that booklet on your own and read every single page so you can have a full understanding of the testing and the testing procedure. So guys, let's get started. I wrote a list on the page numbers that the questions are on so we don't waste too much time. Before we get started, as always, guys, please support me, support this channel by liking this video. You're going to love it. Press that like button now. Subscribe to my channel if you haven't done so already. And don't forget, I have audio lessons available on my website, nexusnursinginstitute.com. So the first one's on page 23. I'm just going to scroll down. Like I said, I'm going to make another video where I actually go through these pages and explain what's going on, okay? But for this video, we're going to be doing questions. All right, so first set. I don't like how this is set up. Give me a sec, guys. I'm going to try to change the setup on this. Well, that didn't work. There we go. Okay. Okay, so here's the first question. The nurse in a long-term care facility is making client care assignments for unlicensed assistive personnel. Which of the following statements by the nurse would provide the UAP with the best directions about the assignment? 1, encourage the client to increase fluid daily intake. 2, ambulate the client 20 feet every 4 hours beginning at 9 a.m. 3, assist the client to perform passive range of motion exercises. Or 4, reinforce physical therapy instructions about the proper use of a walker. And they give you the key. They tell you what the answer is. Oh, you guys can't see me. Hold on a second, guys. There we go. They tell you what the answer is. And the correct answer, I'll move this over here. The correct answer is number 2. So let me talk to you guys about this. First of all, why is number 2 the correct answer? Do you see how number 2 is objective and it's precise? It's not only saying ambulate the client, it's saying ambulate the client 20 feet. They are being very precise. How much to ambulate the client, right? How often, every 4 hours, and when to start, beginning at 9 a.m. Now, if they tell you every 4 hours, beginning at 9 a.m., 20 feet, guys, this is very, very precise. Now, let's look at the wrong answer choices. 1, encourage the client to increase daily fluid intake. By how much? That doesn't give any details at all. All you're saying is increase. Choice 3, assist the client to perform passive range of motion exercises. That is great, but you're not giving what type of exercises. You're not saying how many repetitions or how often. That's not detailed enough. And then choice 4, look at this, choice 4, reinforce physical therapy instructions about the proper use of a walker. Let's talk about this. Number 4 is something you would be doing as the practical nurse or the vocational nurse. The job of the registered nurse, the RN, they do the initial teaching, right? But you, the PN or the VN, you do what? You go ahead and you reinforce that teaching that was done initially by the registered nurse. Unlicensed assistive personnel, they can't do teaching. All they can do is reminding. They can remind the patient, hey, remember the nurse said to do X, Y, Z. Okay, so number 4, this is something that you would do. You would reinforce the teaching. You would reinforce those instructions. But the UAP, all they would do was remind the patient, hey, the nurse said you need to do X, Y, Z, but they wouldn't be reinforcing the instructions. Do you see how wording is very, very important? So anyway, for this question, number 2 is a correct answer. We're going to move on to page 27. That's where the next question is. There we are. All right. The nurse is reinforcing teaching with a client who is using a mechanical lift. Which of the following information should the nurse reinforce? 1, place your hands on the sling. 2, you should lie prone in the sling. 3, place your arms across your chest. Or 4, you'll need to rock to a standing position. And obviously the correct answer is 3, you're going to place your arms across the chest. 1, you're not going to place your hands on the sling. You're going to have them across the chest. 2, you're not going to be lying prone on your tummy. That's not true. Excuse me. And 4, look at 4. You'll need to rock to a standing position. Are we trying to make this patient fall? Absolutely not. Choice number 3 is the correct answer. This one was straight to the point. All right, next question. The nurse is reinforcing teaching with the client about the signs of hunger in a newborn. Which of the following signs should the nurse reinforce? Select all that apply. All right, guys, how do we treat select all that apply? As true or false? And again, we have the answers for us. 1, open hands, false. When do we see the newborn with open hands? 1, if they get startled, they'll do that, right? Or 2, what was my second one? If they get startled. Oh, 2, if they're crying. When they're crying, they tend to go like that as well, but not for hunger. 2, quivering bottom lip. When do we see quivering bottom lip? 1, when they're about to cry, or 2, if they're in pain, because they can't tell you they're in pain, but one of the signs and symptoms of that newborn being in pain is that quivering bottom lip. 3, rooting movement. True. That is a sign of hunger. What is that rooting? You place that bottle or the nipple or finger on either one of their cheek, and immediately they go like this. Why are they moving their head towards that stimulation? They're going to open their mouth. They're expecting food. So true. 4, sucking on the hands. Yes, that is a sign of hunger. It's also a sign, they also do this to self-comfort, but if they're hungry and they're not getting the food that they want, they start doing that. Absolutely. 4, hand to mouth movements. Absolutely. That's also a sign of hunger. So the correct answer 3, 4, and 5. What page is this? Okay, 31. We're moving on to page 36. The nurse is assisting to evaluate the coping strategies of the spouse of a client who had a stroke 5 days ago. Which of the following statements by the spouse would indicate ineffective coping? Guys, I know I'm doing this video, but I'm also on call for my patients. So give me a second. All right. Here are choices. 1, I sleep only for short periods of time since my spouse became ill. 2, I feel frustrated when my spouse turns away and will not talk with me. 3, I eat meals in my spouse's room so my spouse will not have to eat meals alone. Or 4, I have been performing a few household chores each day before visiting my spouse. So with this question, we're looking for signs of ineffective coping. So we're looking for something bad. And the correct answer is 1. I sleep, ding, ding, ding. Look at that word only. Remember, I told you when you're reading and you see those all-inclusive such as only, always, never, it's not good, right? Because there's usually exceptions to the rule. Look at this. I sleep only for short periods of time since my spouse became ill. This patient's not getting enough sleep. So if they're not caring for themselves, getting enough sleep, how are they going to be able to care for their loved one? That is ineffective coping. Now look at the other choices. 2, I feel frustrated when my spouse turns away and will not talk with me. This person's verbalizing their feelings, right? They're verbalizing their feelings. They're looking for help. That's effective coping. 3, I eat meals in my spouse's room so they don't have to eat meals alone. That's effective coping. That's good. 4, I've been performing a few household chores each day before visiting my spouse. So they know that the show must go on. Things still have to get done. So they go ahead and do a little bit each day so they can still make time for their spouse. All of those are adjustments. All of those are effective coping mechanisms, but not one, not getting enough sleep. You're not helping yourself. You're not helping your loved ones. So that's why number one is the correct answer choice. 36, next page 39. Oh, just joking, not 39. Let's try 42. There we go. What page was this? 43. Okay. The nurse has reinforced teaching with a client with schizophrenia who's receiving prescribed olanzapine. Which of the following statements by the client would indicate a correct understanding of the teaching? 1, the medication may cause dry mouth. 2, I should consume a low residue diet while taking olanzapine. 3, restlessness and agitation are common side effects of olanzapine. 4, I will have blood specimen obtained to monitor the therapeutic level of the medication. And they give us a correct answer, which is 1, this medication may cause dry mouth. So this medication, olanzapine, even if you didn't know what the medication was, they gave us a hint. We know that the patient's a schizophrenic, right? And we know with this disorder of schizophrenia, the patient's out of touch with reality. So most likely, even if we have no idea what this drug is, the fact that they're schizophrenic, most likely this drug would be what? An antipsychotic, right? Now, something you need to know about olanzapine, which is an antipsychotic, it has anticholinergic properties. You remember that poem I taught you about the anticholinergics? Can't see, can't spit, can't pee, can't. Same thing. Can't see, blurred vision. Can't spit, dry mouth. Can't pee, urinary retention. Can't, constipation. So the medication may cause dry mouth? Absolutely. That's the answer because that medication has anticholinergic properties. Now let's look at the wrong answer choices. 2, I should consume low residue diet while taking olanzapine. False. We know this medication can cause constipation. We want that patient eat foods that are high in fiber, higher residue, so they're not constipated. We want them drinking lots of fluids. Choice 3, restlessness and agitation are common side effects of olanzapine. Absolutely not. Matter of fact, that's an indication. This patient, we're giving them this antipsychotic medication to relieve, decrease that restlessness, that agitation, that psychotic state. So if anything, that patient may be fatigued, they may be slower in action, they maybe have a little bit of drowsiness, a little bit of dizziness, right? So that's false. They're not going to be restless or agitated. We expect actually the opposite. And then choice 4, I'll have a blood specimen obtained to monitor therapeutic levels of the medication. Not for this medication. For lithium, absolutely. Lithium, which is also used for schizophrenics. Lithium has a very narrow therapeutic index. Yes, blood specimens will be taken periodically for lithium, but not for this medication. So number 1 is a correct answer choice. What page is this? 46. Okay. The nurse is caring for a client with peptic ulcer disease who vomited 150 milliliters of blood-tinged green liquid. Which of the client's laboratory test results would be a priority check? The serum pH, the hematocrit, the serum sodium levels, or BUN? And the correct answer is the hematocrit. So when it comes to bleeding, guys, and lab values, you're going to be concerned about the H&H. You're going to be concerned about the hemoglobin, and you're going to be concerned about the hematocrit. When you see that H&H is increased, their patient's not bleeding. If the H&H is up, most likely what's going on, we're looking at most likely dehydration, right? But if it's decreased, maybe there's some bleeding going on. And we just saw in the question that they just had surgery when? A week ago? Did it say when? Okay. It doesn't say, it just says, excuse me, not even surgery. It says they had peptic ulcer disease and they vomited 150 milliliters. But let's talk about peptic ulcer disease. What do we know about this condition? We know that these ulcers are very easy to what? cause bleeding. So we see that they're vomiting 150 mLs of blood tinged liquid. That's what you're going to be looking at. You're going to be looking at the hemoglobin, and you're going to be looking at the hematocrit and see how low it's gotten. That patient might need to get some blood. Okay, but it has to be addressed. Your serum pH, that doesn't really have anything to do with the bleeding. You know, the normal pH is 7.35 to 7.45. Your serum sodium level, that's an electrolyte, really doesn't have anything to do with the bleeding, but it's very important that you know the range, which is 135 to 145. BUN, when you're looking at the BUN, that's really for the kidneys, and you know your BUN's about 5 to 20. So for this question, the correct answer, guys, is hematocrit. And this is the last question. The nurse is talking with a client who had a subtotal gastrectomy a month ago. Which of the following statements by the client would be a priority to follow up? 1, I occasionally take over-the-counter laxative. 2, I eat several small meals a day. 3, I avoid drinking with meals. 4, I feel tired all the time. And guys, the correct answer is 4, I feel tired all the time. So let's talk about, they had surgery a month ago. And what kind of surgery was it? A gastrectomy, right? A gastrectomy. So we're concerned with possibly what would be going through our mind? Severe anemia. They're feeling tired all the time. Severe anemia, we're going to be looking at severe anemia, and more specifically, most likely what? We're going to be concerned about that B12 level. We're going to be looking at that. That's going to be our main concern. Now, let's look at the other choices. 1, I occasionally take over-the-counter laxatives. Nothing wrong with that. Wouldn't be concerned with that. Now, if the patient says they're taking it serially or they're taking it every day, now we're going to be concerned. But occasionally, that's fine. 2, I eat several small meals per day. Good. Anything that has to do with GI, guys, it's always going to be several small meals per day, and that helps decreases, nausea that comes with GI symptoms and, things like that. 3, I avoid drinking liquids with meals. Absolutely. Why? We want to avoid dumping syndrome. Look at what they had, a subtotal gastrectomy. So the correct answer here is I feel tired all the time. We're going to assess that further, see if there's some blood loss going on or if that patient is anemic. And that's it. That is the test plan, the 2023 test plan for the PN. And like I said, more videos to come where I actually go over the entire booklet and just key in on the most important things for you guys to know. But again, guys, I encourage you to go directly to the website and download that booklet yourself. Please let me know what you thought about this video in the comment section. Let me know what you'd like to see me cover that I haven't done so already. And if you have a moment, can you please share one of my videos on your social media platform? Get me to be able to reach more nursing students. Thank you so much for watching this video, and you guys catch me on the next video.